May is a very important month for medical issues. You know, every month there's something that is highlighted, and we've been talking about things like mental health awareness, and we're going to talk now a little bit about what's going on with health for women. And joining us now, Dr. Fahmi Farah is joining us, cardiologist, one of the best in North America, right here in the Dallas-Fort Worth area. Dr. Farah, it's great to have you back on the radio. Really appreciate you taking time and talking with the listeners all across North America. Welcome back.
Thank you for having me. It's great to be back on your show.
Thank you very much, as always. And you have got a very busy schedule, and that's why I'm very appreciative of you joining me on the program to talk about this. All right, tell folks about you, Bentley, and we'll go from there. Welcome back.
I am Dr. Fahmi Farah, invasive cardiologist and CEO of Bentley Heart, and founder of Global Health Wise Foundation. Great to be here. You can find me on my website at www.drfahmifarah.com.
All right, very good. Thanks very much for joining us on the show. And, when you think about, mental health awareness out there, this is a huge, universal problem. Men and women, are they affected equally? Is this an equal opportunity situation going on about that?
Yes, mental health issue is huge, and it has a big impact on cardiovascular health. And yes, it does, and it can impact both men and women equally.
Okay, and when you look at this as to what is going on with that, do you focus on what is being done as far as looking at this from some of the lesser-known mental health aspects from women? Do women maybe experience symptoms differently than men, as an example? Do they go through this differently, in other words?
They can, especially when it comes to heart disease. Some of the heart symptoms can very much differ in women. For instance, in the setting of a heart attack, sometimes women may not experience chest pain at all. They may have atypical signs and symptoms such as indigestion-like symptoms, nausea, vomiting, more than, whereas in male, they will most of the time have the typical symptoms, which is chest pain. So it's a little bit harder to detect in women because of that different symptoms.
Okay, very good. And as far as that, the numbers are concerned, this is why companies have really got to zero in and focus on the importance of this, raising awareness about the educational side of this. Preventative care, the preventative measures really do go a long way for men and women, right? That as the more that they know about a particular subject matter, then they're more apt to be proactive to take care of themselves, I would imagine.
That is correct. A lot of this is preventable, and the more proactive you are, the better it is, which is mitigating your risk factors. Things like high blood pressure, high cholesterol, diabetes, smoking cessation, all of those will help a lot, reducing those risk factors. Mental health is a risk factor in and itself. People who have depression and anxiety, they are at higher risk of having heart disease and heart attack. So, talking to the right people, getting medicated, and just receiving help and treatment to reduce those risk factors are very important when it comes to prevention for cardiovascular diseases.
Now, the driver population out there, doctor, that we've got thousands of women drivers all across the United States, and they're out there, they're doing their thing, got to drive and keep going out there. And during Women's Health Month, we often focus on physical well-being, but shedding some more light on some of the lesser-known mental health aspects that women may encounter and how they can maybe navigate these challenges effectively. Would isolation or loneliness be maybe part of that consideration?
It certainly can be. Isolation and loneliness are two of the biggest factors that lead to depression and anxiety. And when you're isolated, when you're depressed, you're less likely to live a healthy lifestyle. You're less likely to want to put in that extra effort to make healthy food. Same thing when it comes to exercise. People who are depressed, they're not going to want to get up and go to the gym. A lot of unhealthy behaviors can come with it as well. For example, substance abuse, smoking, and alcohol consumption are usually higher in these folks, just because that's what they turn to for help. and those are not good for heart health either.
And Doctor, we talked about the importance of preventative care for women, such as regular screenings and checkups. What are some of maybe the key screenings that women need for each stage of their life? And if they put it off and just don't go, can this create heart issues? Any age recommendations changed or been updated as of late?
The screening would be very similar in men and women. I would say if you have any family history of early heart attack or heart disease, definitely that's something that should prompt you to go see your doctor and possibly get your heart checked. If you have symptoms, don't ignore those. Also, risk factors. If you're somebody who has high blood pressure, high cholesterol, diabetes, you need to get into our cardiologist's office earlier in your age group and get that evaluation done. So it's any signs and symptoms or risk factors or family history, those would be the early ones that should prompt you to go get your heart checked.
Now, let me ask you this, Doctor. Do most people even know what their cholesterol levels are or what their blood pressure numbers are? That for most?
Unfortunately not. But yes, more people do need to become more aware and find out what those numbers are, because that can go a long way in terms of preventative measures and the appropriate actions that you can take early on to prevent heart disease.
I know somebody that is a manager of a restaurant here in the Dallas area, one of the big ones. And what's really interesting about this, that this individual has had a number of issues concerning heart health. That young man, about 32 years of age, and when he's at work, he likes to slam down those energy drinks. Oh, maybe he's told me before, like 3 to 4 during the course of an 8-hour shift. And one morning, early in the morning, about 2 in the morning, he had to be rushed to the emergency room because he was getting heart palpitations. The energy drink just accelerated his heart rate to the point they had to provide him with some kind of a chemical regimen in order to slow the heart rate down. He's done that. He's stopped with the energy drinks, but now he's picked up vaping. So is that kind of a double whammy on the heart, that maybe we are going through maybe some experiences in life, could be traumatic, stressful. We maybe get rid of one vice and pick up another along the lines. And that's great.
Oh, absolutely. Absolutely, yes. Smoking is a risk factor, and vaping is a new thing. And yes, vaping is a risk factor for cardiovascular disease. In fact, recent studies have shown that there's a particular type of heart failure that is associated with it. People who vape are at least 25 to 30% higher risk of having that heart failure, that particular type where your heart just doesn't relax very well, the muscle stiffens up a little bit. So yes, I absolutely encourage everybody to not pick up vaping, and those who are already vaping to quit.
When you mention heart failure, for somebody like me, not on the medical side of the equation, is that the situation where it's simply the heart just stops? Is that heart failure, or is that a gradual thing with heart failure?
With heart failure, yes, your life expectancy can reduce. With heart failure, of course, the symptoms can significantly reduce the quality of life as well. People can have shortness of breath, swelling in their legs, and just not be able to carry on the same duties and activities that they used to be able to before. A lot of them can go in and out of the hospital quite a bit, and that can, of course, interfere with your quality of life as well.
Okay, yeah, absolutely. And the reason I'm asking the situation like that, a friend of mine that she's working in an office here in the Dallas area, and she decided to take the stairs. She works out on the 3rd floor of a building here in the Dallas area, and was absolutely winded. Just could not get up to the 3rd floor. Had to stop halfway and then try to get rest. And this brings to mind the fact that a lot of the drivers, truck drivers out there, do a lot of stair climbing. They've got to go into warehousing or climb in the back of trucks and things like that. If you are getting really winded doing, say, daily activities, is that maybe another sign to get the heart checked out by a cardiologist if you get short of breath very easily?
It is, yes. If you're getting short of breath or just fatigued and tired with regular activities, that is a clue that there may be something going on with your heart, and you should get that checked.
Okay. All right, let's do this. I've got a break for some commercials, and drivers, I'd love to get you on board. If you want to talk to my guest on the program, Dr. Fahmi Farah is on, one of North America's leading cardiologists. And, you think about everything going on with your body from, sinuses, allergies, aches and pains and things like that. But the center of the universe is going to be your heart. I mean, if that thing is not working properly, okay, you're out of the game. And we're going to talk more about that. We're going to want to get into more of the conversation with all of this. Are many of you on heart medication right now, driving that truck? Some of you may be taking things like digoxin as an example, or maybe you're taking Lipitor. We'll go into all of that and what it can do. We'll go into all of that conversation, but first, let's go into the conversation about the weather. That's coming up next right here on the SiriusXM 146. Go away. Nice to have on board Dr. Fahmi Farah, one of North America's leading cardiologists. And like I mentioned, the heart really is the center of the universe for your body. I mean, if that's not working right, nothing is going to go right. That's why I got to bring on board Dr. Farah to help you. And, Doctor, let's get all of the contact points out. Social media, phone number, website. Where can they go? Where can they find you?
You can find me at www.drfahmifarah.com, also on Instagram and X at Fahmi J. Farah.
Okay, very nice. Thanks again for joining me on the program to talk about all of this. And, one of the most interesting things about the fact of activity and the importance of getting out and moving about, just to keep the blood circulating, is that many of us are weekend warriors. And what I mean by that, we might be sitting in a truck all day driving, or we might be in the office sitting all day or on the phone. Do you find that as people get ready to go into the weekend, they get this big burst of energy? They want to get out there and play softball. They want to go jogging, mow the lawn, and they're not ready for it. If you're not prepped for that, can that cause maybe some heart issues? Do you see cases like that of the weekend warrior winding up in the emergency room?
Yes, we see people who are just doing their ordinary work and ending up in the ER all the time. A lot of times what happens is we have a very fit person who works out all the time, and they're on their jog, and all of a sudden during that jog they have a heart attack and end up in the emergency department. So you could be doing really anything, and that heart attack can happen while you're working out, while you're working, or mowing the lawn. A lot of times we get it in the winter time when people are, there's ice and snow. Snow shoveling is one of the things that commonly can cause a heart attack in a lot of people. So that's why even if you feel like you're fit, you have no symptoms, you really do need to pay attention to your symptoms, or if you don't have symptoms, your risk factors, and get your heart checked is very, very important.
Okay, very good. And what I've been noticing lately, Dr. Farah, is when I'm visiting trucking offices or going into any kind of establishment, I am seeing more and more of the defibrillators on the walls of companies that, in the event of a heart attack, break glass, and there's the defibrillators. Is that becoming more and more prevalent these days, that companies are realizing the importance of those devices, having them installed, and then maybe having teams of people that might be trained in the event of a cardiac emergency inside of the office here?
Yes, we are seeing that more and more in public places, and it's a great thing. We want even more people to be aware, because a defibrillator, in the study of an emergency, if somebody's having an acute heart attack and they have a cardiac arrest as a result of that, it could be completely life-saving. And so, yes, the more we have it in public places, the better.
Okay, and what do these devices do? Do they provide like an electrical shock to the heart? And number two, say somebody like me, for example, or anybody that's got no medical training, will the device walk you through that process as to how to use it?
You do need to have some basic understanding of how to use that device. I don't think anybody can just walk in and know how to use it in an emergency because time is of the essence in that time. So I do feel that people do need a little bit of training, and so CPR training is what it entails, and that's available to anyone. You don't have to be a medical professional for that. Anybody can get certified for CPR. So it would be better if somebody who is CPR trained who is using that device. But even if somebody doesn't, yes, it should have a little label on that machine that tells you where to put the pedals and how to press the button. So technically speaking, yes, anybody should be able to use that. But being familiar with that certainly helps.
Okay, very good. And so in essence, what does it do? Does it stop the heart or recharge it, or is it kind of like a battery boost? I know that's not the right way to say that. But what does it do exactly when it's used?
So what a defibrillator does, when you have a cardiac arrest, your heart stops. And a defibrillator basically shocks the heart and puts the heart back in rhythm and will restart that heart. So it doesn't necessarily stop the heart. It essentially restarts it.
Okay, very good. And it's really quite a science that when you think about how those things are developed, but my travels as of late to different trucking companies, I'm seeing more and more of those on the wall, which really is quite encouraging. So, and again, circling back to the importance of understanding CPR, it's an easy process to learn. Would you encourage all of the motor carriers companies out there that are listening that if they don't have a CPR program in place, I don't know, maybe online or in person, start one, in other words?
Yeah, like I said, CPR is something so essential. It's life-saving, and everybody can get trained for it. There are many, many companies out there that does it. American Heart Association is one of them. So I recommend anybody to get certified for CPR. It's the life-saving for your loved ones.
Okay, very good. Doctor, thank you very much for joining us on the program. That's Dr. Fahmi Farah on. And again, Doctor, one more time, where can folks find you guys on the web? Where can they go?
You can find me at www.drfahmifarah.com and on X and Instagram at Fahmi J. Farah.
Okay, Doctor, thank you very much for joining me on the show.